Good morning, gorgeous. Good morning, gorgeous. Don't forget to smile as you look radiant as you are the queen of your Nile. Wake up, beautiful. It's time to spread your wings. Open up your window. Hear the bluebirds as they sing.
Good morning, good morning, good morning, good morning, gorgeous. Welcome to Good Morning, Gorgeous, your Saturday morning dose of inspiration. I am Sharonda Steele, and
I am Larissa Williams.
we are so excited to have our guest on today. I know we said that a lot, but that's because we have really great guests. Like we can't help it.
Yes,
We know some
yes.
phenomenal women. And this one is definitely up there. We have with us today Dr. Jamilah Page. Dr. Page and I met each other about a little over a year ago. And when I tell you, such an incredible woman with a great spirit, so I'm so glad that she's here with us today. Good morning, gorgeous.
Good morning, gorgeous.
We are so excited to have you on, Dr. Page.
I'm so happy to be here. I'm excited about this.
Yes. And we're going to go ahead and get started talking because I know once we get started, sometimes we can't stop. Dr. Page and I have been working on a community garden. So we've spent a lot of time together over the past year or so. But we're going to try to narrow it all down and get through our talk for today. Dr. Page, why don't we just start off by you telling us a little bit about yourself?
Sure. Hello, everybody. My name is Jamilah Page. I have a PhD in nutrition. I'm also a registered dietitian. I completed my undergrad at the illustrious Tuskegee University. So I am a product of Booker T. Washington and George Washington Carver, who I'm always proud to talk about. And I completed my graduate studies at Auburn University. So I am a true Alabamian. I grew up in Birmingham, went to school in Tuskegee, Alabama, and then eventually to Auburn, Alabama. My current position is the professor of nutrition at Berea College. I am an assistant professor within the rankship of professorship.
So you went from being in Alabama to now being in Kentucky.
Yes.
How is that transition?
It's different. It's different. Number one, the winter comes so fast. It comes much faster than what I'm used to. This was my first time truly experiencing snow. That was both whimsical and scary. So it's been a transition, but I also see the beauty that Kentucky has as well.
Mm-hmm.
You know, Alabama, the beautiful, but every state, every country, every place has its own beauty. And so I've enjoyed being here and I've been able to meet people like you all.
Yes. Well, I'm just so excited for you that you accepted our invitation to come on to Good Morning Gorgeous. And look at that smile so early in the morning, such a beautiful smile. So we do truly thank you for being here with us. But my question, let me ask you a question. Because I know each thing is this question is a little bit different, but my question to you is, what prompted you to actually transfer to come to Kentucky?
Oh, wow. It was, I think, number one, a lot of prayer, because anytime you're trying to look for a job, you always want to make sure that you find a group that you can, you want a cohesive work environment, be able to know your colleagues, get to know your colleagues. So already looking for a job is already a task. But what I loved about coming here was that, number one, it was outside of my comfort zone, somewhere I've never truly experienced. I have family in Louisville, but being here is different. Being at this particular college is different than what I'm used to. And I think, number one, even though I say I'm not a big risk taker, I'm still very up for an adventure. I'm always up for a challenge. And so coming to Kentucky I was looking at other jobs, and for some reason this one spoke to me the most. And I don't regret that decision at all. Not at all. It's been a big learning process for me. I feel like I've grown a lot here. I've learned a lot about myself here. And honestly, I am in the happiest place I've ever been in my life.
Wow.
Awesome.
So
Oh,
good.
yes, I've enjoyed being here.
That's so good. I said the same thing when I moved here. And of course, it felt like forever ago. But I said I learned a lot about myself once I got here. Like this being here really helped mold and shape me into who I've
Yeah.
become. And some of that may
Mhm.
have some things, some of the parts of that have something to do with maybe academics and career wise, but just overall as a person, I really have been able to grow since I've moved to Kentucky. So
Right. And even though I'm a Kentucky native, I'm actually from Louisville. Well, I was born in Shelbyville, Kentucky, but raised in Louisville, Kentucky. And moving from Louisville to Lexington for me was even totally different because even though we're in the same state, the way
Mm-hmm.
that they are rivals has
yes.
made a difference. And I feel like for me being here since I've been here since 1991, ladies, okay, in Lexington. But I feel like for me, if I had not moved to Lexington, I would not have been able to connect myself with some powerful women,
Absolutely.
That's good.
you
Oh,
know,
yes.
That's
because,
good.
that had been my prayer years ago. I remember it like it was yesterday, asking the Lord as I was driving to work one morning, God, there are women in my circle that don't need to be. So
Oh,
God, I
yes.
pray, I was like, God, I need you to remove those people from my
Wow.
I
circle that
felt that
doesn't
one.
That's
need to
so
be
good.
connected to
That
me.
was so good.
Yeah. And then
So
but
good.
help me let them go.
Yes,
Okay.
Exactly. And
that's
there
the
has to be
key
that
there.
breakup.
It
That's
has to
the
be
key.
that
Yeah.
breakup. And I
Yeah.
said, and
Mm-hmm.
Lord, replace them with some powerful women that are going to help me grow, whether they
Yeah.
be young or old. God,
Yeah.
replace them with somebody that's going to help me.
Absolutely.
Yeah. I've
Yeah.
always said that, sometimes we hinder ourselves by keeping people in our lives that were only meant to be there for a season.
Absolutely.
Some
Yes.
people are not meant to be there forever, and that's okay.
That's
Exactly.
okay.
Stop trying so hard to just keep people there. And we wonder why all this turmoil is happening. Their season has ended.
Mm-hmm.
When your
And it's
season has ended, it's time to move on. Like it
Mm-hmm.
really is time to move on and let go. And I do
mm-hmm.
believe, we have these moments where people are in our lives for that moment because there's something that either we can learn from them or they can learn from us. And when it's done, it's done. And others
Mm-hmm.
are meant to stay longer, and that's okay.
Exactly.
That
And
is
you can't always see the blessing unless you let those people leave.
yeah.
They
Yes.
they
So good.
come, they show you what they need to show you. You
Yes.
take the lessons, but and a lot of people only think of a breakup as something romantic, but
Yep.
it's hard breaking up with your girlfriends. I
It
think that
is.
can be harder than breaking up in a romantic relationship. And so that breakup has to happen. And once you learn the people that are supposed to be here permanently, and then the ones who do have a season, you start to see the evolution of yourself. You start to
Wow.
truly see, okay, I'm growing now. I'm not in that place anymore. Because if they stay too long, they'll only pull you down when they're
Yeah.
only supposed to be there for an increment or a step to elevate you. And
Yeah.
that's where it's supposed to be. And it can
Mm-hmm.
be so hard.
Yeah.
Oh, it can
Yes.
be so
Yes.
hard.
I think that is probably one of when we think about the ideas of people being in our lives, some for a season, some for a lifetime. Because when I decided to move from Lexington to Berea, Kentucky, which is much smaller, I was worried about having a circle.
Me
And just
too.
by chance that I wanted to have a community garden, I learned Dr. Page wanted to have a community garden, and we've been able to grow this relationship from
Yeah.
that base alone. And I
Awesome.
began to learn a lot from you, especially with the nutrition and everything that we've been doing. I mean, we talk about the fig tree, and I am going to try the figs. But I know that the nutrition and healthcare, those things are important to you, especially diversity when we think about
Yes.
that. So can you tell us a little bit about your thought on that?
Absolutely. I am I don't want to say a product of public service. I believe that public service is a part of me. Um, I grew up in Birmingham, Alabama, and at one point my mom was laid off and almost unemployed. My father was deceased. My baby brother's father is incarcerated. So my mom raised four children by herself. And for a while, we had to depend on our family food banks to take care of us. And I want to say that that was maybe my first introduction to what community work and public service really means. And so from there, I wanted to do research. I've always loved research. I'm still a lab rat at heart. When I love DNA extraction, gene mapping, what have you. I love all of that. Looking at different contents in different foods. But there's something to say about working with people and being out there with those people, because it's one thing to say that fruits or vegetables are good for you, or to know why they're good for you, all the way down to the composition of the food and antioxidants, the structures, or what have you. But when the people out in the community that need it the most, who are the ones suffering from certain health disparities or certain health conditions, don't get access to those fruits and vegetables, why does the work in the lab matter at that point?
Wow.
And so that's what really took me from the traditional laboratory to making the community my lab. And so from there, I moved from working in the regular lab to be dabbling in extension and doing a little bit of both, to now where I am, what's the next partnership? Who else can we get in this email or in this meeting? What's next? How can we do this? And one thing that I love about you, Sharonda, Dr. Steele, is that we've been able to, number one, bond on something that's true to our hearts, wanting to help other people, wanting to support other people and support God's people. And so just that humanistic part of us and being able to be colleagues, and then one of my sisters in my sister circle, and I'm so happy to have you. But that's what it means to really be equally yoked with other people and get to be able to bond on what truly matters. So I love working with the community garden. I also love any type of outreach initiative. I also partner with the food bank, which every time I go to the food bank, it almost brings me to tears, because I think about what it meant to receive those boxes and what it meant for us to say, okay, we have this chicken. How can we save this chicken? How can we get it for, make sure we can make the most out of it? How can we make the most out of these strawberries or whatever these frozen vegetables are? Sometimes the items in the box don't really mesh. And so that's my newest project with my students in my healthy cooking class, is that their final project that with the food bank that we partnered with, to look at the staple items that the recipients get in their boxes, and they have to create a recipe based just off of those particular items, because they never know what they can do with those items. Some of them just don't match. Like they'll have applesauce and then cereal, canned okra. How do I make a meal out of that? And those types of needs of the community are what draw me to being out there. Like, this is a real need. Not that I fully support lab research, and I always dabble when I can, because it's something about a test tube. I don't know what it is. A test tube and a flask and a beaker make me a little happy. But I will say nothing brings me more joy than being out there with the people and helping them on things that they can do in their everyday lives. And so I think that there has to be diversity within this kind of work, because you never know who you're going to interact with. I've had students here at Berea to look at me, and when I introduce myself, say, oh yeah, I'm a dietitian. And the first thing they always say is, I've never met a Black dietitian.
Wow.
Which is interesting, because before I went into the field, neither had I.
Wow.
I decided to be a dietitian just hearing about it. My mom's a personal trainer, so growing up, we talked a lot about health. My dad actually passed from cardiovascular disease, which is the #1 killer in the United States, #1 cause of death in the United States. And so we grew up knowing about these things, but also being a heavier girl naturally, learning about food. I couldn't understand, well, what is it about my weight or my body that I don't understand? And that's when I learned that there's more to health than just weight. And a lot of times we don't include that, especially with something like BMI, which initially was not supposed to be used in healthcare. And because it didn't include a diverse group in the establishment of BMI, it's pretty exclusive. It's a little discriminatory. And so
Yeah.
there's a reason why we need to have diverse professionals in different types of healthcare. Healthcare isn't just the facility itself. It's not just a hospital. It's being out there and supporting, making sure people get, access to fruits and vegetables,
Right.
access to lean meats, being able to know how to cook them. That starts with our primary care of how we prevent certain diseases. Secondary care is when we help manage it. If someone does develop diabetes or hypertension, how can we manage it? We want to do those two first before we get to tertiary care where people are in the hospital.
Right.
And a lot of times when they get into the hospital, there may not be people that look like them there either.
Right.
So there has to be a connection. When I was working in Alabama doing some of my hours for my dietetics and dietitian credential, I met a lady who was about 67 years old. She was close to 70 years old, living with HIV. And I walked in with the dietitian. The dietitian was in front of me. She spoke to her, but when she saw me come around the corner, this older Black woman, the first thing she said when she looked at me was,
Aww.
there's a connection there. There's something to say about when the person who's supposed to be helping you and educating you on your health is different when they look like you.
Yeah.
It's a little bit different. Not that other groups aren't as effective, but there is a historical divide in how the majority has treated our particular people or different types of groups in healthcare versus how their own are treated. So that's why we have to have diversity. Everyone needs to be there. It's not something that's supposed to be exclusionary at all. So that's why I do love the fact that, especially with the community garden, we've been able to bring in so many different types of groups to be partners. Yes, Sharonda and I are African American, and we've kind of pulled the people together. I'm more of her support. This is Sharonda's project, but I just want to be there to help her do whatever she needs to do. But we've been able to pull in so many different types of people with so many different levels of expertise and types of expertise that's what's made this garden successful. It couldn't just be one group because that's not what the world looks like.
Right.
Not at all.
And I'm glad you're introducing that to your students too, even in your class. I love that you're taking those boxes from the food bank and their project is to figure out, what do I do with this box so that you can then have something to provide to those families? Because then it changes that resource, right?
Absolutely.
It becomes more now, because now I have this box and where most people look at it just singularly. Okay, we have some cereal. What can I do with this? It may just sit in the shelf for a little while till I figure it out. Now they'll have a guide of these some things that you can do with what's in your box. So we're educating those families on a whole other level. And I love that.
Right. Exactly. And even with the box, with they're having the boxes, with Dr. Page doing that, they'll think the next time on what they have available in their cabinets.
Yes.
And in their refrigerator that they can put together. Oh, I can make a meal with this, this, and this, because now their way of thinking is totally different than it was before. And that is so creative. And that's awesome. That's amazing.
And even some of your students who they probably have never had to have a food box before. They gain a different awareness and appreciation even for those that do need it. Because some people, when it's out of sight, out of mind, you don't tend to care about it as much. So now you're bringing a whole different level of care for students that you have that may have never ever had to go to a food bank.
Exactly.
They'll see it very differently when they're back in their circles and back with their families.
Exactly. Some of them looked at the items because we toured the food bank first, and then they were able to see the items that the recipients get on Monday, Wednesday, and Fridays. And some of them who had never been to a food bank, like you said, they said, "What do I do with these?" And I said, "Well, imagine the people who sold groceries come from these types of places,
right?
And you don't even know what to do with these items."
Yeah.
Think about the ones who have to depend on this every week to feed their families and don't know how to prepare a meal for them.
Right.
Yeah. I
This
went
is
through
what
that
it means to
experience.
really meet the need of community.
I
Mm-hmm.
went through that experience when I was going through my divorce, and oh my God, it it was a very, very hard experience for me. Um, because I myself never thought that I would have to be on food stamps. I myself never thought that I would have to go to a food bank. And
Mm-hmm.
those were ways that, because there were several times going through my divorce and just in my general, just in life in general, let me just say in life in general, where I had may have been laid off from a job and lost my job, and what I was getting from unemployment wasn't enough to pay my rent and buy groceries and pay for utilities. So having to
Mm-hmm.
go to those food banks was very, very hard for me. I had to swallow my pride, and like, I have these two sons that I have to take care of, and
Yeah.
we need food. So and then I remember when I finally was able to get a full-time job, how excited I was to go to the family for cabinet services and let them know I got me a full-time job. Now God is getting ready to bless another family to
Mm-hmm.
be able to have the
Absolutely.
resources that were given to me, that I never thought that I needed, because we don't know. We have no idea.
Never.
We could be the next person,
Yes.
Exactly.
and
Exactly.
I was just so excited. I thank God for the opportunity for it to be available for me.
Yes.
And then also thanking God that I'm off of it so that he can bless someone else,
Yeah.
another
Absolutely.
family. So yeah, yeah.
Yeah. Good stuff.
I'm glad that you brought that up because I had one student who interned, he did an internship at a food bank. And one of the first things he said was, we had people actually come to the food bank, need a box, but they were driving a BMW or a Jaguar.
Mm,
And the first thing I said is, because you don't know
yeah,
what happened in
you don't
between
know.
getting that Jaguar and
Mm-hmm.
by the time that they needed the food bank. You never know.
Yeah,
Especially
yeah.
with the pandemic. This was in the middle of the pandemic. They did this
Right.
internship. You never know
Never
what
know.
hardships that people encounter. Like it's one thing for people they were trying to tell my mother, oh, why don't you just get child support? Well, when my father was deceased and my baby brother's father was incarcerated, child support from where?
Right.
Mm-hmm.
Right.
you know and so that's a story of a lot of different people, and we have to be sympathetic to that. We have to be understanding that things happen,
Yes, they
our
do.
circumstances change, but that doesn't
Yes.
mean that our love for each other change. That doesn't
Yes.
mean we still don't need to have those food banks there, because like you said, they're a ministry to people.
Yes.
Community work is a ministry. And the
Mm-hmm.
one thing that has to come out of it, I'm glad you all talked about the recipe part, is that by the time they're able to go and look in the cabinet and think about what they had, it's just that promotes behavior change.
Yep.
When you promote
Yes.
behavior change, that's when you change health. That's when
Yes.
health status changes.
That gave
That's
me
when
chills.
That's good. That's
so
good
that's
stuff.
what it has to be. Something outreach is more than just, oh, I'm giving a box. It's really providing people the tools to how to live, and giving them everything they need to adjust things to fit their culture, their budget, their lifestyle, because everyone's different. There's not a one size fits all.
Yeah.
Mm-hmm.
But once you provide, it's the same concept of, it's one thing if you give a man a fish, you feed him for a day. If you teach him how to fish, you feed him for a lifetime.
Right.
Yes.
And I
I love
thrive on that. That
I
it
love
just can't
that.
just be, thank you. It can't just be a one-time service or support. It has to be, number one, it has to be consistent.
Yeah.
It has to be consistent, but it also has to be something that is integrated throughout their lives, whether it's making sure that people have access to get exercise, like walking on a track that's in a community, or if their community is not even safe enough for the children to play outside, how do we change that? Because
Yeah.
if they're not getting enough physical activity, how can we have healthy hearts?
Right.
So those are all of the pieces that I believe that where community work is truly my ministry, because I want to be out there and see what is it that the community needs. because that's exactly how I met Sharonda. I said,
It
anybody
is.
wants a community garden? Anyone looking for a community project? And there we go.
So true. I wonder though, we may have some listeners or viewers that, especially when we think about nutrition and they may want to do better, they're not sure where to start. Because it's always, and you can have the mind frame of, I really want to change this area of my life. But some people, we're so stuck in how we've always done things that, if I've always fried this or I've always done this with my box, a lot of times they don't have the mindset of how to switch it or change it so that it can be healthier options out there. What would you suggest to those folks who may say, I don't know where to start when I think about trying to get a little bit on this healthier journey?
That's a great question. What research has shown us is, for example, I'll use The Biggest Loser for an example. People loved The Biggest Loser when it was popular. And one thing about The Biggest Loser was a lot of those people gained the weight back because they're restricting themselves to maybe 1,000 calories a day, maybe 1,000 calories a day, working out 4 hours a day, and being constantly monitored by someone else. Where does that actually fit in real life?
Right.
So what we do know is that the literature shows us that small sustainable changes are what change health. A $15 water bottle can really change someone's habits. Wow. Just making sure that they take sips throughout the day. It doesn't have to be a gallon all at one time, but being able to have a nice size water bottle that you routinely fill up, you get your water intake. Or, you know what? I don't think I had any vegetables today. And before you know it, you're having more vegetables or what I call nutrient dense foods than the energy dense food or the calorie dense foods. The ones who have more calories or energy than nutrients that you need for your body. I don't say healthy and unhealthy foods in my class, because one thing that I feel strongly about is, once you call a food unhealthy, you're probably attacking someone's culture. Yeah. And the last thing we will do is talk about or demean anyone else's culture. Yeah. But what we can prove is if something has more antioxidants than another food. We can prove that something has more energy or more calories than another food. That is something we can prove. So making sure people get more energy, more nutrient dense foods, than energy dense foods are what make the difference. Those small sustainable changes, maybe taking a walk for 30 minutes, 3 times a week. Before you know it, you meet the guidelines for the physical activity guidelines for Americans, because now you're at least getting 90 minutes a week. Right. So those small sustainable changes, I think a lot of people think, oh, I'm going to change my life. And they think they need to rearrange their entire house. They think they need to throw out all the food that they have, switch to tofu, only go vegan, when that's not always the answer. Some people choose to have those kinds of foods. Some people choose to participate in certain dietary patterns like veganism, vegetarianism, but that doesn't have to be you. Right. Your body is different. And also I want to that point, I want to say something a little bit about weight. We focus way too much on numbers, so much to where it's toxic, so much to where that we have so many people developing eating disorders. When I worked in the eating disorder clinic, I think a lot of times there's the stereotype of eating disorders only affect white women, when it affects everybody. Yeah. Anybody can be insecure about their body, or made to feel that they're not beautiful or they're not enough, experience some type of trauma like rape or molestation, which is what I saw. A lot of them are still dealing with those predators in their lives. Some of them are family members. Yeah. And the eating disorder isn't about the food. It's about gaining some type of control of their lives that they've lost. Wow. And so unless we truly embrace the fact that everyone needs this type of care, everyone needs to be involved in these small sustainable changes, those are what make a difference. Wow. Those are what make a difference, because these conditions, these diseases affect everybody, regardless of color, creed, nationality, sexuality. It affects everybody. So I would say those small sustainable changes, making sure you get 30 minutes of walking a day. if that's all you can do. And that's enough. That's enough. YouTube has been great for me exercising. I can pull up a video and do yoga and then I'll go back to having dinner. But those small things that are consistent, making sure you get water every day, making sure that you have some fruits and vegetables every day, getting the exercise every day, that's what makes a change. And you'll see it in your overall health. You'll see that you feel better. And then eventually, sometimes the weight will go down as a part of that. But if it doesn't, your body is what your body's meant to be. And you're supposed to still love this body, because regardless of the trauma, regardless of what you've been through, this body's taking you through it.
Yeah.
And you should appreciate this body.
Mm-hmm.
And it doesn't have to look like everybody else. Everyone's not meant to be a size 8 or a size 6. Everyone's not meant to be a 12. But that doesn't mean that you're not healthy.
Yeah.
Weight is a very poor indicator of health. It only tells us one thing. It may say that we're at risk for certain things, but it doesn't mean that you're not healthy.
Right.
So I would say that we need to focus less on a number and look at what it means to live a healthy lifestyle altogether.
Well,
Amen.
Nuggets today.
Yeah.
This is always the case when we're having these kind of conversations.
I got all kind of notes. And see, and an idea just popped up to me. So we did an interview yesterday, and something just popped in my mind that when we get to a certain point, I would love to be able to invite all of our guests back to have a workout with Miss Shonda James. Wouldn't that not be awesome?
Oh, that'll be fun.
It'd be fun. It'd be a lot of fun.
That'd be really fun.
Yeah, yeah. She gave us a little small workout. It was good though. I needed
it. Was good. It was good. It was.
Oh yeah.
It was.
But yeah, you know, I remember we went out to eat once and we were ordering potato wedges and tenders, and Dr. Page go, "What kind of vegetables do you have?" Wait.
I love
her, but I think you know, in hindsight, she really truly lived out the message that she like. She truly lives out that message, honey, because she is going to get her vegetables on that.
Oh my goodness!
All right,
but that was so funny that day. You're making me I'm laughing into tears.
It was funny though, because I'm like, we are celebrating and you asking for broccoli. It was so funny.
But did it make you change your menu? Did it make you change what you ordered?
Who, Dr. Page or me?
No, Dr. You, Sharonda.
Oh, I still ate my chicken tenders.
Look, and that's what it's supposed to be. Don't let anybody influence your decision.
But
you stick to you.
But I will say this. Over the past couple of months has been the most that I've had tomatoes and cucumbers, because the more and more we're working around these things in the garden, I'm able to pull them in and try them and really enjoy what I'm having and learning how to cook with a lot of items that normally I wouldn't have cooked with. Because if I were to do a vegetable, it probably would have been broccoli, and that's it. But I am learning about Swiss chard and all this other stuff. So I think that the more and more we are hearing and learning about these different resources, connecting with other people that understand it, the better it is long term. Because I have been adopting more of a healthier lifestyle than probably that I was before. But look, anytime I go to Lexington, I'm getting me a Five Guys burger.
And when I go with you, I will get a Five Guys burger.
It may change. That may change in the future. But I really have started learning a lot more about fruits and vegetables and how do we slowly begin to intake, to introduce those into our lives. But I love the fact that you don't say healthy and unhealthy foods. I love that. I've never heard anyone in health say that before, but it's so true, because you're not trying to attack the person in their culture or their background or what they know. Because some folks, if you're in poor communities, certain type of foods is all you know. We can date
Exactly.
that, but we're not gonna get on that conversation. But I do think that you don't want to attack a culture or who someone feel like they are, or all of what they know. Because if you begin to attack that, now you make them feel like you're less than what they're meant to be.
Exactly.
I love that when you say we don't say healthy or unhealthy, but we do say, hey, we look at these areas to define if this is something that we should have, or how much of it we should have.
Exactly.
So I'm definitely gonna start using that now.
And then it helps people change what, if they do have a certain cultural food, right? When we talk about what some healthy practices are, like making sure that if you're going to use canned foods that are high in salt or high in sugar, rinse off your beans first, or rinse off whatever the vegetable is to reduce the salt content or the sugar content. And then regardless of what dish they're putting it in, they've still made a change that's better for their health. And so it's something that they can apply regardless of what their culture is. So yes, I think changing the language has been the biggest part of my practice, because I see more people are more receptive once you change the language, versus if I just call your food healthy or unhealthy, you're done listening to me by that point.
Yeah, change the language.
I've created a barrier. There's a wall now that's gone up, because I've talked about your culture or something that's personal to you. And just like with the Five Guys burger, I talk in class that Big Mama's chocolate cake has a place in nutrition. It has a place because it makes us happy. And now the dietary guidelines reflect that 85% of what we eat should be the whole grains, the fruits and vegetables, yada yada yada. But now 15% of what we eat can be that saturated fat. It can be those trans fats. It can be those added sugars, like the cake, like the Five Guys burgers, because there's still something to say about health and happiness still influencing each other.
So good.
I like it.
There's something to say about health and happiness. Listen to you.
Yeah, look. Food makes me happy. So if I'm not gonna like the food, I'm not gonna be happy.
True.
I have to make it happy.
And if I don't eat, I'm definitely unhappy.
I'm definitely not happy.
But I will say, you're the first person I ever tried a fried green tomato with.
Oh, I love some fried green tomatoes.
Dr. Page was making them a couple of weeks ago. And it was the first time I ever tried one. So yeah, I love it.
Southern Belle.
You have truly just given us some wisdom, and I love it. Yeah. I love it.
Thank you for having me.
I'm so glad that you came on today, because this conversation is definitely much needed. And we'll have to circle back around, because you said so many different things that almost can become a talk in themselves, like changing the language, right? Like all those pieces, I think, become a mindset shift, and it has to start somewhere. Change the language is really where it can begin, right?
Absolutely.
Because a lot of times, something isn't real until we name it. Well, that's the way we think. Something isn't real until we name it. So we start changing how we speak about certain things, then it has an effect on how we think, and then how we behave. And it all just have this even flow. So thank you so much for coming on today.
Thank you for having me.
So good, like so good.
Oh, and this was fun.
Anytime you get started talking, honey, we already know, especially in this area, you're going to go.
I love it. I love this.
I know, but it's good stuff. And I do think it's important, because we're, those that may be watching or listening, they're going to hear something and go, yes, yes. And I think that is what we want to see happen through this experience that's being created, is how can we touch as many people as possible and help them along their journey. So I am excited. Thank you so much for coming on today. And we're going to go ahead and get ready to close off, but always with Good Morning Gorgeous, we want you to find yourself, believe in yourself, and love yourself. Oh, I love it. Everyone, goodbye. Have a great day. We are, thank you for being here today.
Thank you.
Bye, everybody.
Bye-bye.